shaft. Hello everyone, welcome back to KinetiCare, your go-to platform for mastering anatomy in a simple and clinical way. I am Dr. Abir Ali, and in today's lecture, we are going to cover Chapter 3, Radius and Ulna, Osteology. If you want to understand forearm movements, fractures, and clinical cases, this lecture is extremely important. So make sure you watch till the end, and don't forget to like, subscribe, and share with your classmates. 1. Introduction. Let's start with the basics. The forearm consists of two long bones, radius on the lateral side, thumb side, ulna on the medial side, little finger side. Together, these bones allow flexion and extension at the elbow, supination and pronation of the forearm. Important concept. The radius moves and rotates. The ulna remains stable and acts as a supporting pillar. 2. Radius. General features. Lateral bone of the forearm, shorter than ulna, expands at the distal end. A. Proximal end. Let's break it down. 1. Head of radius, circular and concave, articulates with O capitulum of humerus, O radial notch of ulna. 2. Neck, narrow region just below the head. 3. Radial tuberosity, present on medial side, attachment of biceps brachii tendon. Posterior part contains bicipital bursa. B. Shaft of radius. Borders, anterior, posterior, interosseous, sharp medial border, surfaces, anterior, posterior, lateral, nutrient foramen, directed upward. Mnemonic. To elbow I go. C. Distal end 1. Styloid process, lateral projection, attachment for brachioradialis. 2. Ulnar notch, articulates with head of ulna. 3. Articular surface, articulates with O scaphoidolunate. 4. Dorsal tubercle, Lister's tubercle, posterior surface, guides extensor pollicis longus tendon. D. Muscle attachments, proximal, biceps brachii, supinator, shaft, flexor digitorum superficialis, flexor pollicis longus, pronator quadratus, brachioradialis, distal, pronator teres, extensor tendons around dorsal tubercle. E. Ossification, primary center shaft, 8th week intrauterine, secondary centers. O. Lower end appears at 2 years, O. Upper end appears at 5 years. F. Applied anatomy, very important. 1. Cole's fracture, most common fracture, fall on outstretched hand, dinner fork deformity. 2. Smith's fracture, reverse of Cole's, fall on flexed wrist. 3. Galeazzi fracture, radius fracture plus distal radio-ulnar joint dislocation. 3. Ulna, general features, medial bone of forearm, longer than radius, enlarged proximally, narrow distally. A. Proximal end 1. Ulcranon, elbow prominence, insertion of triceps brachii. 2. Coronoid process, fits into coronoid fossa during flexion. 3. Trochlear notch, articulates with trochlea of humerus. 4. Radial notch, articulates with head of radius. 5. Ulnar tuberosity, attachment for brachialis. B. Shaft of ulna, borders, anterior, posterior, interosseous, surfaces, anterior, posterior, medial, nutrient foramen, directed toward elbow. Mnemonic. From elbow I flee. C. Distal end 1. Head of ulna, articulates with radius. 2. Styloid process, attachment for wrist ligament. D. Muscle attachments, proximal, triceps brachii, brachialis, flexor digitorum profundus, shaft, flexor carpi ulnaris, extensor carpi ulnaris, abductor pollicis longus, distal, pronator quadratus. E. Ossification, primary center shaft, 8th week IU, secondary centers. O. Lower end 4 to 5 years. O. Ulcranon around 10 years. F. Applied anatomy 1. Monteggia fracture, ulna fracture plus radial head dislocation. 2. Ulcranon fracture, due to fall or direct trauma. Triceps pulls fragment upward. 3. Ulnar styloid fracture, often with Cole's fracture. 4. Radio-ulnar articulations. There are 3 joints. 1. Superior radio-ulnar joint, head of radius plus radial notch, stabilized by annular ligament. 2. Middle radio-ulnar joint, interosseous membrane, transverse force. 3. Inferior radio-ulnar joint, head of ulna plus ulnar notch of radius, contains TFCC. Movements. Supination, right pointing arrow palm up. Pronation, right pointing arrow palm down. Key concept. During pronation, radius crosses over ulna. So that's all for today's lecture on radius and ulna osteology. If you found this lecture helpful, like the video. Subscribe to KinetiCare, share with your friends, and don't